بسم الله الرحمن الرحيم. السلام عليكم. Inshallah, this video will be the last video in the dental anatomy at a glance series, and we will talk about the permanent mandibular molars, the first and the second one. We will start with the permanent mandibular first molar. Some notes in the beginning. Normally, the mandibular first molar is the largest tooth in the mandibular arch. It has 5 well-developed cusps, 2 buccal, 2 lingual, and 1 distal. And this is one of the differences of the mandibular first molar from the maxillary first molar, is that in the mandibular first molar, 5 well-developed cusps, while in the maxillary first molar, only 4 of the cusps are well-developed and functioning, and the 5th cusp is poorly developed, and it is called the tubercle of Carabelli. It has 2 well-developed roots, one mesial and one distal, and this is another difference from the maxillary molars, is that the maxillary molars has 3 roots. The maxillary molars have 3 roots, while the mandibular ones have only 2 roots. We'll start with the landmarks from an occlusal aspect, which we can see. We will start with the pits. We have 3 pits: a central pit, a mesial pit, and a distal pit, and between them the central developmental groove. This is the central fossa. A distal marginal ridge and a mesial marginal ridge. So let's repeat the landmarks together more clearly. We said 3 pits: central pit, mesial pit, and distal pit. Between them is the central developmental groove. We have a mesial marginal ridge, a distal marginal ridge, and the central fossa. Now we will continue the landmarks of the occlusal aspect of the mandibular first molar, and we will talk about the developmental grooves. We have in the mandibular first molar, we have 2 buccal grooves: the distobuccal developmental groove and a mesiobuccal developmental groove. And this is one of the differences of the mandibular first molar from the mandibular second molar, which has only 1 buccal groove. Okay, let's keep this in mind. So in the mandibular first molar, we have a distobuccal developmental groove and a mesiobuccal developmental groove and a single lingual developmental groove. This is the central developmental groove, and these are supplemental grooves. What we have also, we have a mesial triangular fossa and a distal triangular fossa. Let's repeat the landmarks. We said there are 2 buccal grooves, a distobuccal developmental groove and a mesiobuccal developmental groove, and a single lingual developmental groove. Between them is the central groove. 3 pits: central pit, mesial pit, and distal pit. 3 fossa: a mesial triangular fossa and a distal triangular fossa and a central fossa. Now let's talk about the cusps. We can see there are 2 buccal cusp, the distobuccal cusp and mesiobuccal cusp, and 2 lingual cusp, the distolingual cusp and the mesiolingual cusp, and a single distal cusp. So 2 buccal cusps, 2 lingual cusps, and 1 distal cusp. Now from a buccal aspect, what we can see, this is the distal side and this is the mesial side. We can see the distal root and the mesial root and the cervical line, and most importantly from a buccal aspect we can see 2 developmental grooves, 2 buccal developmental grooves. the mesiobuccal developmental groove and the distobuccal developmental groove. From a lingual aspect, what we can see the two roots, the root trunk, the cervical line, and a single lingual developmental groove. From a mesial aspect, we can only see the mesial root, the cervical line, and we can see a developmental depression here, and the cervical ridge. This is the cervical ridge. It is more prominent in the mandibular first molar than the mandibular second molar. It is more prominent in the mandibular first molar and less prominent in the mandibular second molar. So this is the cervical ridge. This is the mesial contact area. From a distal aspect, we can see the distal root and a small part of the mesial root, the cervical line, and the distal contact area. I didn't concentrate on the cusps because it would be a very complex explanation. Now for the permanent mandibular second molar. We will do a direct comparison with the mandibular first molar to understand the differences. The first difference, in the mandibular second molar, the crown has only 4 well-developed cusps, 2 buccal and 2 lingual, of nearly equal development. So neither a distal nor a fifth cusp is evident. The first difference is that only 4 cusps are present. 4 cusps. The other difference, only one developmental groove lies buccally, which is the buccal developmental groove. So from buccal aspect, we can, in the mandibular second molar, we can see a single buccal groove. The other note is that the cervical ridge buccally on the crown portion is in most instances less prominent. So the cervical ridge, we talked about it just a moment in the maxillary, in the mandibular first molar, we said it is prominent, while in the mandibular second molar it is less prominent. So these were the most important notes about the mandibular molars. I hope this series is useful to you and lets you remember the most important notes about the teeth and how to differentiate between them. Thank you for watching, and inshallah we will meet in the next series إذا أراد الله. في أمان الله.